Hi, I'm Dr. Alicia Sequist from the Massachusetts General Hospital Cancer Center in Boston, and I specialize in the treatment of lung cancer. Today, we're going to talk about targeted therapies for lung cancer. Targeted therapies are also sometimes called precision medicines, or molecularly targeted drugs, or molecularly targeted therapies. In particular, today we're going to focus on a type of lung cancer targeted therapy called ALK inhibitors. Let's first discuss how targeted therapies work in general and how they differ from chemotherapy. Chemotherapies kill cells that are dividing and function on the principle that cancer cells are dividing more often or more rapidly than normal cells within the body. As researchers have learned more about the genetic changes or mutations that cause cancer to develop, they have been able to develop drugs that specifically recognize and hone in on features that only cancer cells have, like certain genetic mutations. In this way, the treatments can directly target cancer cells. One class of targeted cancer therapies that is currently available focuses on the anaplastic lymphoma kinase gene, or ALK, genetic mutation. These ALK-directed drugs, like many of our oral targeted cancer therapies, are a type of medication called tyrosine kinase inhibitors, also known as TKIs. Cancer cells often have protein receptors on their surface. I often describe these protein receptors to my patients as antennas that are on the outskirts of the cancer cell, receiving signal messages that can help direct the cancer cells to grow. When a cancer contains a specific and defining mutation or a change in its instruction manual, it then goes about its business in a defined and unique way, including by putting a certain type of antenna or receptor out there on its surface. We can then take advantage of this distinctive receptor being there to act like a beacon and direct the TKI drug where to go and which cells to kill. When the TKI drug gets to the antenna, it interferes with the signal that is sent and the cancer stops growing. Targeted therapies that are TKIs work best when the correct match is made between the type of mutation within the cancer and the corresponding type of TKI. As mentioned earlier in this video, we will discuss a group of TKIs called ALK inhibitors. There are currently two marketed ALK inhibitors, or ALK TKIs. Crizotinib, or Xalkori, is approved for patients with metastatic non-small cell lung cancer who are ALK positive. And ceritinib, or Zycadia, is approved for patients with metastatic non-small cell lung cancer who have progressed on or can't tolerate crizotinib. In addition, many other ALK inhibitors are currently being studied in clinical trials. ALK inhibitors work by blocking the signals that the ALK protein receptor or antenna sends to grow and divide. Recall that the ALK protein does this only in cancers that have a type of DNA change called an ALK rearrangement. So that is why ALK TKIs work only in patients that are ALK positive on gene testing. ALK inhibitors are taken orally in pill form. Crizotinib is taken as a pill twice a day, with or without food. Ceritinib is taken as a pill once a day, and it should not be taken within 2 hours of a meal. Overall, these drugs are well tolerated with a few key side effects. The most common side effect that crizotinib causes is a minor and reversible change in vision. This includes trouble looking at light, blurred vision, double vision, seeing flashes of light, and new or increased floaters. These eye problems aren't usually troublesome enough for people to stop treatment, and they often fade over time. Other common side effects include nausea, diarrhea, vomiting, constipation, swelling of the hands or feet, and feeling tired. Low testosterone is one source of fatigue in ALK-positive patients being treated with crizotinib for their lung cancer. This can also lead to sexual dysfunction and depression for some. Hormone replacement therapy has been found to be an effective method of managing these side effects. Serious side effects of crizotinib may include liver problems, lung problems, and slow, fast, or otherwise abnormal heartbeats. The most common side effects of ceritinib include diarrhea, nausea, elevated liver blood tests, which can indicate liver damage, vomiting, abdominal pain, fatigue, decreased appetite, and constipation. Serious but rare side effects of ceritinib include liver problems and lung problems, as well as severe or long-running gastrointestinal issues. High blood sugar is more likely to be an issue for patients with diabetes or glucose intolerance. Slow, fast, or otherwise abnormal heartbeats have also been seen. One challenge of TKIs, including ALK inhibitors, is that patients with lung cancer who initially benefit from them eventually develop resistance to them. As a result, their lung cancer may grow or spread. This is known as acquired resistance. Cancer cells are clever enough to eventually find a way to bypass roadblocks so that they can survive. The genes within the cancer may even mutate further in order to overcome the effect of targeted drugs. Doctors and researchers are working to overcome resistance in tumors and to keep tyrosine kinase inhibitors effective against lung cancer for longer periods of time. The next generation of ALK inhibitors is being studied in clinical trials now. I hope that this video has provided you with a better understanding of tyrosine kinase inhibitors, in particular ALK inhibitors, and how they may apply to your treatment plan. Be sure to check back at longevity.org for updates and more information.